for Ukraine. Please check previous talks at YouTube. You can sign up for additional interesting conversations and presentations. And today we have Eszter Hargittai, who is a professor and chair of Internet Use and Society at the Department of Communication and Media Research at the University of Zurich. And at the moment, she's also a visiting research scholar at Center for Information Technology Policy at Princeton University. And today's talk is misinformed about COVID-19, digital inequality in unsettled times. And Professor Hargittai also has a book. I think she'll also maybe tell about this upcoming book at MIT Press. We'll be interested to learn about that. Professor Hargittai did a lot of research sponsored by US National Science Foundation, John and Catherine MacArthur Foundation, Alfred Sloan Foundation, Google, Microsoft Research, Facebook, Nokia, Merck, and many, many others. And the research of our speaker today is focusing on how people benefit from digital media uses, and in particular, how digital skills of different people depend on sort of their, the differences in these people. And in terms of the speech, we'll have 40 to 50 minutes for the presentation. You may ask questions in chat. And after the presentation, we'll be able to have about 15-20 minutes for discussion, and our speaker will address your questions. So thank you very much for joining, and please, the floor is yours, and thank you for joining us today.
Great, thank you so much. I'm honored to be speaking with you today, and this is indeed some work that is part of a book that's coming out in less than 2 months with MIT Press. So I want to start by acknowledging the situation you're in and condemning the atrocities that Russia is waging on Ukraine and this horrible, senseless war. A few days after the war started, thousands of people marched in Zurich in support of Ukraine. So I just wanted to mention that, and many people in Switzerland have tried to help in small ways that we can in supporting refugees and sending support to Ukraine, including its free press. On a more personal note, I wanted to mention I have a hobby where I exchange or send postcards around the world. So I designed this postcard that I've been sending people to keep Ukraine on people's mind. And if anyone would like me to send them a postcard, one of these postcards, I would be happy to. Just send me your postal address. I also wanted to share some of the creative designs that people have created. These are some of the postcards that I have received in the mail. So I just wanted you all to know that you're definitely on people's minds, and we very much, many people out there are very much against this war, and we're so sorry that you're having to experience it. So now turning to the research that I'm doing. So first I wanted to share this cartoon. I don't know if anyone's familiar with it, but I am a sociologist, so this is where I am. And I know there are probably some economists in the audience, and it would be interesting to know where you think you are on this spectrum. But I just wanted to clarify that that is my background. So I tend to see the messy in research and recognizing that studying people is a messy enterprise. So today there will be 2 parts to this talk. I will start briefly by saying a few words about digital inequality, which is very much the focus of over 2 decades of research that I've been doing. And then I will tell you about this COVID study that I did and share some results from that. So the really big overarching question that guides a lot of my research is who's most likely to benefit from their digital and media uses and who might be left behind in all this. And with the idea that we want to make sure that the increasing dissemination and reliance upon digital media in everyday life doesn't end up recreating inequalities that already exist in society, and ideally that it would help people. So you may have heard of this term, the digital divide, which refers to this idea that some people are not online and then others are. It tends to put this in this very binary mode, though, where it seems that once people cross the digital divide, everything is fine. And the argument I and many others have made in the last 2 decades is that this is too simplistic a view, because merely being connected certainly does not mean effective, efficient, and informed uses. So that it's actually more helpful to think about inequality with respect to digital media as a spectrum, where we recognize that even after people get connected, their digital access and context will vary, as will what they do online. And so one way to think about this model is that, so we have people's sociodemographic background, which a lot of research has shown often will then lead to and result in differentiated digital contexts. And then this can result in very different life outcomes in all sorts of domains, from health to job opportunities to financial opportunities to education and whatnot. And in terms of digital context, I will be focusing on 2 aspects of this today. One is what we call autonomy of use, which is basically the freedom to use technology when and where one wants to. So having mobile access and home access on a laptop and having a tablet is better than simply having a mobile a smartphone on which you can access the internet. And then digital skills is another important concept, which I will say a little bit more about on the next slide. And so internet skills can encompass all sorts of aspects of being an informed internet user and digital media user. And here are just some of the aspects that matter for skills. And I've done a lot of work on this over the last 20 years. And for anyone interested, the article that I mentioned on this slide gives you a nice introduction and primer on the various dimensions. So why is it helpful to look at internet skills? So an important reason for this is that skills is something that we can actually intervene on. So we know from a lot of literature internationally that certain sociodemographic factors relate to how people use the internet. That, for example, people of lower education tend to engage in what we call capital enhancing activities less than the more educated, for example. And while we can always strive for getting people to have more education, more realistic probably intervention is to try to target people's skills, which turns out to be very important in what people do online. So 2020 happened. None of us will forget with COVID. And so it turned out that my personal coping mechanism for dealing with the pandemic was to throw myself into work. And I know everyone dealt with it in different ways, but that seemed to be my version. And so I checked with my research group members if anyone was interested in studying the pandemic. And the first couple of days, the responses were lukewarm, but then members of my team decided that yes, they were in fact quite interested. Part of the reason was that it became very clear very quickly that digital media were going to be central to how people are living life during lockdowns, and digital media is what we study, it's our expertise, so we wanted to be part of the conversation. So very early in the pandemic, we started gathering data about survey data, as I will explain, about people's internet uses, lots about their social media uses, but then also offline indicators, what they were doing more generally. And so those data form the basis of the findings that I will share today. So we ran national surveys. We contracted with an online survey firm, Cint, There are limitations to what one can do online, of course. However, especially in the absolute middle of initial lockdowns, there were not really other options, right? So everybody in the world was trying to figure out how to live life. And so doing a phone survey would have been quite hard. In-person surveys were obviously out of the question when everybody was supposed to be distancing. So online survey was it. This, of course, raises limitations for the study, given that the study is about differences in online usage. So I want to recognize already up front that people who had the least amount of access and who were least skilled would of course be the least likely to end up in these studies and in our samples. So I do want to acknowledge that. If anything, though, this means that if we do find socioeconomic differences in usage, then those are probably conservative to what we might find if we had gotten an even more diverse group. So I just want to acknowledge this limitation up front. So we collected data really early. So a few weeks after lockdowns. In these three countries. So why these three countries? Well, I'm based, when I'm not on sabbatical at Princeton, I'm based in Switzerland. And so we, of course, wanted to see what the local situation was like. As you might recall, Italy was the first country outside of Asia to be impacted by COVID. There were deaths there earlier than most places. It spread quite quickly. And Italy also borders Switzerland. So we're very interested in the situation south of Switzerland, in a country where also the government had enacted much stricter limits on people's mobility than some other countries. So in that, Italy really had a hard lockdown, whereas Switzerland and US had more of a soft lockdown. And then we included the US as well, because a lot of research on digital inequality is done on the US, so we wanted to have that comparison. So you'll note that the timing is a little off in that in Italy, this would have been about 6 weeks after they had gone into lockdowns, and more like 4 weeks in the other two countries. We took a little longer to launch the surveys in Italy and Switzerland, partly because we had to do translation from English in the case of Switzerland to 3 languages. So we quota sampled on age, gender, education, and region, just to make sure that we would be getting a diverse group. And so here are sample descriptives, and we did indeed manage a diverse group. These are variables that, so later I will be reporting on results of some regression analyses, and I just want to say that these are variables that I include in all of those models. So unless I say something is based on just a bivariate analysis, assume that the findings that I share have all of these variables in the models. One thing I want to point out, which is not as common in this research, is that I also have information on disability status. So it's certainly in a global health crisis, disabled people would be a population especially of interest. And we do know that disabled people were one of the groups that were potentially highly impacted by COVID. So it's also a population on which I have done some other work and something that digital inequality scholarship should take seriously. So I'm happy to have those data. I did apply survey weights because we are comparing across countries and there are these limitations of the online data collection. And so just quickly, these were the sources of the weights and the groupings that I used. And so other than the core descriptives that I just shared about the sample, and I guess the core information I will share about autonomy of use is not weighted, but all of the results I share are based on weighted analyses. Okay, so and these stats will not be weighted either. So COVID knowledge is a key variable in the study and something I will focus on as an outcome in the various analyses that I share. So I just wanted to share how we measured COVID knowledge. And so here's one of the multiple choice questions we asked. And I share this partly to show you that these are not trick questions. We actually purposefully avoided anything with the slightest tinge of potential political slant because that wasn't our purpose, right? So we actually don't ask about masks, for example. For one thing, back in spring 2020, there was actually quite a bit of confusion, and at least in some circles, and it wasn't as universally recommended as maybe it should have been. But again, we purposely don't go there at all. We use the World Health Organization's Mythbusters website, where they list knowledge that was clear at the time, and a lot of this hasn't actually changed even since. And so those are the kinds of questions we ask. And here's what we get. I mean, overall, you will see from the data that the vast majority of people are quite knowledgeable. That said, in the case of a deadly virus, even some people not knowing even a few things could have very real repercussions. So I think important to recognize. Here's another question, which I think is quite important, precisely because if you don't know the right answer here, you may be putting other people at risk potentially. And I'd say quite a few people didn't know the right answer here. Again, given the severity of this information, like the implications of this knowledge. So overall, we had 5 multiple choice questions. And again, you see that with some of them, quite a few people didn't know the right answers, and that was quite troubling. So we have a score here of 0 to 5, how many people got correct. And then we also asked some true-false questions about ways to reduce the risk of being infected by COVID. And again, not particularly controversial, but these are ways that were widely held as being helpful. And so overall, we end up with a score of 0 to 11 that people could have on the knowledge score item that we have in the survey. You see here that, again, as I mentioned, I mean, a lot of people did know a lot, and that's very encouraging, but not everybody, and there are differences. It's also interesting to note that in Italy, the knowledge is higher. And again, perhaps because it was so much more severe there from the start, but we're also a little further into the pandemic there when we collected the data. We also have data on separately conceptualized misinformation or misconceptions. And here, there were 2 separate true-false questions, again, about how to avoid, how to prevent getting COVID. And you could argue, well, does it really matter if someone thinks that a hot bath is going to help? Well, it matters because if people think that they can thus be more carefree or don't have to worry as much, that is actually problematic. You will know some of the racial tints of the situation. For example, in the US, with a whopping 22% believing that if you avoid buying products made in China, that will actually help you avoid COVID. But all sorts of interesting other findings as well. So again, here we have an index score of misconceptions. And here again, we see that quite a few people didn't believe any of this, which is encouraging. And again, people in Italy did much better than the other 2 countries. But this still leaves a lot of people believing at least a few of these things as potentially helpful for avoiding COVID, which is problematic. So one of the things we measured in the survey was whether people were closely following news about COVID. If nothing else, almost as a control, this is worth including in the models. And so overall, quite a few people were following at this time in the pandemic, probably not surprisingly, the information about COVID. The relevant finding is, again, probably not surprisingly, is that those who were following the pandemic closely were more knowledgeable, and they were also less likely to hold misconceptions. So that bodes well for some of the information that was being disseminated, although I'll get back to that later. It's pretty complicated though. Okay, so let's go back to the focus on digital context. So I mentioned autonomy of use is the freedom to use technology when and where one wants. And so there was quite a bit of coverage in the US, especially about the really bad situation in which people had access to, or did not have access, in fact, to the internet. In this case, we have a case of children sitting in front of a fast food restaurant trying to get free Wi-Fi to do their homework. Pretty bad situation. It wasn't quite so bad in Italy, and especially in Switzerland. In fact, as I tried to find cases of problems in Switzerland, my searches just resulted in Swiss media covering the disastrous situation in the US. So that was interesting. Which is not to say that everything was completely fine in Europe either. The closest I could come to data on this was a survey in Germany, Austria, and Switzerland. So aggregating the data about the three countries, showing that even there, some people didn't have ready access to technology at home. So even in countries where there is more digital access, there were a situation like the pandemic, that kind of unique situation still posed problems for some. So in terms of the sample here, some people only had one home internet access point or one type of device, which is in contrast to what I would call a much more robust internet access, home internet access, where you had access on 3 types of devices, which is the variable that I use in the analyses. And then there's also differences in how often people are going online, and some people only did it once a day. Relevant for the question here today is, does this relate to COVID-19 knowledge? And in bivariate analyses, it does. And I will show later that it also does once we control for various factors. Okay, then there's this question of internet skills, and over the years I've developed an instrument to study skills, and here is how we studied social media skills in the survey. You need something fairly simple to, there are really complex scales out there, but you can't include those on a survey that's focused on so many other things. So social media skills are negatively associated with age. People who are more highly educated and have higher incomes are better skilled. And then there is no link to disability status, which is relevant to note though, because in the past, there's been negative relationship of skills to disability. So that was interesting to note. And skills as well are positively linked to more knowledge. This relationship, however, is not there with misinformation, and I'll get back to that more later, but I guess I can say now that, interestingly, knowledge and misinformation about COVID at this stage in the pandemic is not simply 2 sides of the same coin. So it was possible to be knowledgeable, but also hold misconceptions. So here are the results of OS regression analyses, where the 2 highlighted variables on top are the digital context variables, so autonomy of use and skills. And so here showing that even when we control for all sorts of sociodemographics and even following COVID news, the digital context variables matter for understanding COVID better. We can also look at the other variables just to see who was more knowledgeable.
Sorry, can I ask a quick question? Sorry, I think I missed it. So how is this COVID-19 knowledge, I think I missed it, measured? What's the scale for the COVID-19 knowledge? Is it binary, 0-1, or it's...
No, so this was the 0-11. So we had the 5 multiple choice questions and then the 6 true or false questions. So it's a 0 to 11 count.
And it's OLS, right? So it's like 0-51.
It's OLS, yes.
Okay, thank you.
Yes,
thank you.
It's OLS. Yes, and I mean, the variance wasn't humongous, so that I can actually very quickly go back to, this was right. So it's very skewed, but nonetheless, there is a difference. But frankly, given that it is not like, it's actually quite skewed, it's interesting to have quite robust findings nonetheless. And so one of the most robust findings is that disabled people had less COVID knowledge, which is interesting because they were one of the categories of people especially at risk. And then we also find that women, which is generally the case, tend to be more knowledgeable about health matters, and that's true across countries here. Otherwise, the findings don't necessarily hold across countries. So in the US, we have this interesting finding, and that people of Hispanic origin and African Americans were less knowledgeable. And there's a very complicated history in the US of healthcare and minority race and ethnic groups, which probably explains some of this. And curiously, income is negatively related to knowledge in Switzerland, which is, I don't actually have an explanation, and welcome thoughts on that. Although education is in the predicted direction, which is that we would suspect more educated people to be more knowledgeable, which however does not seem to matter in the other two countries. So there's some interesting findings, but in terms of the digital inequality story, the story is that digital context doesn't matter. So I also, I had a lot of questions about information sources, and I'm not going to talk about this a lot today, but I did want to show you a little bit of this. So this was the question, which you can read. So we asked about different information sources that people consulted for learning about COVID, and not pictured is a list of online resources as well. So government websites, health websites, websites with statistics about COVID spread, and then also social media, which I don't talk about today. So this was the English version, and for those not familiar with the US media market, so ABC, CBS, and NBC are the main channels. They're the ones that don't require cable. It's the easiest for people to access. And then many of the ones that follow, Fox, MSNBC, CNN, are cable, and then PBS is the public channel, and NPR is the public radio. So in Switzerland, this is what this looked like, and there's a reason I'm showing these details. So it's the same question in German, and we also had it in French and Italian. And then SRF, or the way I refer to it, SRG, is the Swiss Broadcasting Company, which is very strong in Switzerland. And it's worth noting that so every year, every household has to pay hundreds of francs to support SRG. And in case you're wondering if this is just the remnant of a very old system, there was actually a referendum a few years ago about whether people wanted to continue paying this. And there was a strong majority that voted in favor. So people, which shows, again, shows quite a bit of support, that people are really willing to pay hundreds of francs a year for SRG to exist as it does. This will become relevant. And then asked about all sorts of other types of media sources. And so the big story here, which I show here for SRG, again, this is the Swiss Broadcasting Company, is that, so this is just kind of graphical representation of the relationship of the SRG as source of COVID info to knowledge based on OLS regression, where I control for all the variables you've seen so far, right? So this is really that independent effect, and you can see, and it is statistically significant. So the more often, in fact, you relied on SRG as a source of COVID info, the more your knowledge. Again, controlling for gender, age, income, education, disability status, and the digital context variables. That's pretty strong evidence that this mattered. In the US case, I don't have this graphically represented, but in the US case, of all the many information sources, the only source that mattered positively for knowledge were the three main network channels, ABC, CBS, and NBC, which is interesting because ultimately we have very much an old media story here, that it was TV that made a difference. And this was also the case in Italy, where it was Rai, which is a big national broadcaster. What's very interesting is for misinformation as outcome, again, controlling for all the other variables that you've seen, SRG, relying on SRG as a source, helps in not falling for misinformation. It's the only source. And interestingly, in the case of Italy and the US, there is no source that matters once you control for sociodemographics and digital context. So it shows, in my opinion, it partly shows just the very considerable amount of confusion that the world was living in April of 2020. And again, shows that knowledge and misinformation are not two sides of the same coin, as I mentioned. And is, but I think this slide in particular is very positive about SRG, who had nothing to do with my survey, just to be clear, and I have no relationship to them. Okay, so now to look at an outcome. So I recall from my original model about digital inequality, we have sociodemographics that often are related to people's digital context. And then the argument was that digital context then might also relate to life outcomes. So what's a relevant life outcome in the pandemic? Well, there was certainly the COVID knowledge variables we have looked at, but you could ask, well, why do we care if people understand COVID? Well, one very real life outcome to that is whether you're quarantining and not quarantining, but basically sheltering in place. Are you following government recommendations that you shouldn't be going out? So there was a question on the survey very early on that just asked people where they have gone in the last 2 weeks. This is very neutral, with a bunch of locations listed that here I have listed in order of frequency. And so not surprisingly, people did leave the home to go get groceries, but other things they didn't necessarily all do. You can see here Italy's much stronger restrictions in that there you couldn't just go out walking, running, things like that. And you can see that it was much less common in Italy for people to have done that. Well, what I highlight here is this bottom list of activities is what I call optional, right? So none of these were essential to maintain your life, right? So the ones above are, I mean, you could even argue that going for a walk or run or bike ride isn't really necessary either, but certainly the ones on the bottom are absolutely non-essential activities. So I was trying to be fairly conservative in what I classified as such. And you can see again the big difference between Italy, where only 4% of people did any of this, compared to over a fifth in the US and Switzerland. And so I take this as an outcome to see whether knowledge mattered, understanding COVID mattered to abiding by these guidelines. And yes, so what we find is that people who left their home for optional activities have statistically significantly lower COVID knowledge in all three countries. And then, right, so if you understand COVID less, you're more likely to go out, even though you shouldn't really be going out. If you understand COVID more, then you are staying at home. And the reverse of this is true for misconceptions, where what we have is people who are more likely to hold misconceptions about COVID are much more likely to be going out for optional activities. So I'm actually going to wrap up. I didn't think I would need 40 or 50 minutes. So to sum up, People's digital media uses very much varied during COVID by socio-demographic characteristics, as a lot of digital inequality research would suggest. And also these socio-demographics were related to people's digital context, especially autonomy of use and skills, which is what I focused on here. Better digital context links to more COVID-19 knowledge. So a digital inequality story in and of itself there. It was mainstream television, not cable television, and not other types of media sources that link to COVID knowledge. For COVID misbeliefs, it's only in the case of Switzerland that we find an information source that actually helped against it, and that was the national broadcasting company, SRG. And knowing more about COVID relates to taking fewer risky behaviors. So what's left is for me to thank my team, who were instrumental in making all this happen in terms of the survey. And we actually also have, we published, I think, 10 papers that don't overlap with the book at all about various aspects of the data, which were led by some of these people. And then, so you can access those papers at the QR code on the right, and then look for my book in 6 weeks. And now I am happy to answer questions or hear comments.
Okay, thank you very much. I think it was a very interesting discussion. I learned a lot myself. I'm economist, so I do research on other topics related to COVID, but it was interesting to look at this from the point of view of a sociologist, right? So I think there is definitely some overlap, right? I think it's very interesting survey that you ran. Let's wait if anybody asks question in chat, right, in YouTube or here. But before we wait, I have a couple of questions. So the first question is, I have actually two questions related to what you just shown. So first question is like simple technical. So for United States, you included this racial identifiers. I wonder what would happen if you drop these racial identifiers, if you run the same variables as you did for Switzerland and Italy. Will results be different? I don't know if you did this exercise, but I'm just curious.
Oh, well, that's a really good point. I don't think I actually ran those models without the racial variables, because that tends to be so important in the US to include. But I appreciate that point that it would make it could make the comparisons better across the three countries if I drop them. So yes, I should definitely do that. I haven't done that.
Yeah. I think it may be interesting because I was puzzled by this different effect of income, right? In US, it's positive, in Switzerland is negative, right? This is something that kind of strikes you, right, as economist. And second question, we kind of know that there is a lot of misinformation and propaganda, right? Trump, for example, in the United States, and also I remember that you said that you try to avoid this kind of political component, right? And again, when you think about Italy, again, there's a lot of misinformation, maybe less in Switzerland. I don't know much about Switzerland. And you showed that for certain channels, it was a clear link sort of between how often people watch it and sort of the less they are misinformed. But if you look at this sort of more politically biased channels like Fox News, for example, right? Did you find any evidence in difference, right? Let me explain why I think it's important, right? There is like recently, I've heard the joke that, if there was internet, there would be no Nazi Germany, there'll be no Hitler. But in fact, we have it in Russia. They have internet and they still have this, crazy political agenda. So it's interesting, like whether people watching certain biased media, maybe they are more likely to believe in, don't buy Chinese post from Chinese post or something, right? Because it's biased, it's racist, maybe it's not explicit, but it's kind of hinting in this direction. So I remember that you said that not many things have been significant, but maybe, maybe some coefficients have been significant.
Yeah, no, thanks for that question. And yeah, so there's no obvious link from whether it's Fox or MSNBC, which would be kind of the other end potentially, that one would expect. But it may be that, again, this was fairly early on in the pandemic. And if one were to do this data collection even a year later, even 6 months later, which, I mean, other people have certainly done. There's been a lot of research about COVID, and what's unique about our study is that it's really that very early time, and in some ways, I do think maybe that's why it didn't capture that yet. I should add, I forgot something important, which I mentioned in the abstract, and I'm glad you reminded me, which is that I don't show this, and I first forgot, but I do also control for political ideology in after I ran these models that I showed. And in Italy and the US, it didn't have it didn't show a relationship with knowledge. In Switzerland, there was a slight relationship in that people who claim to be more conservative were a little bit less knowledgeable. But again, in that early time in the pandemic, this didn't show up. To be fair, I should note, and this was shaded out because it's not something I talk about in this presentation, but we did collect another survey data set a month later in the US, where we did actually include some of those more politically based comments, like Trump's hydrochlorine or whatever that was called idea, and there you do see that relationship. So it really may be the timing, that this was such early timing that there wasn't yet time for the politics to enter the round that much yet. But I can imagine that later there would be more of such findings.
Okay, interesting. And what I also find puzzling is that like if I understand the results correctly, is that digital divide is present even if you control for education, age, and income, which is for me kind of like this is like strange, right? Because you would think that somebody who is better educated, richer, they should be sort of right. But even if you control for that, it's still there. That's kind of interesting. I think that's an interesting result.
Yeah, I mean, it really shows that access, having robust access and skills actually really matters in its own right. Or we have, or these models don't yet control for what it is exactly that's going on that explains that difference.
Okay, great. Thank you. Very interesting presentation. I should definitely check papers and the book. So if you don't have questions, are there any questions? So we have one question in the chat. So we have a question from Ilona Knishuk, who is asking, what do you think are the reasons for the appearance of certain beliefs about COVID? Where does it come from?
I mean, I guess it'd be helpful if I could get some clarification. I mean, Ilona, do you mean the misbeliefs, like things that people make up, or which types of beliefs are you referring to? I'm not quite sure which ones you mean.
Let's see if Ilona is here. Is this question coming from Zoom or YouTube?
Oh, I see.
Yeah, so we are waiting. Let's see if Ilona, can you clarify? I know that you cannot speak, but maybe you can type real quick.
She still seems to be on Zoom, so maybe she can clarify.
Okay.
But I mean, I think it's fair to say that, so what I haven't talked about today, because it really then opens up a whole other talk, is social media, which, and in the book, there's a whole separate chapter that focuses entirely on social media as a source of information. And clearly, a lot of material is spread there. And generally, the results show that more discussion and more reliance on different social media platforms actually links to less knowledge. So that's a potentially troubling relationship there. And it also links with more misperceptions. So there's room for things to go differently there in the future.
I love this example. I think it was published in Guardian that out of 9 recommendations by bloggers for fitness, 8 are detrimental. I mean, if you follow it, you'll actually gain weight. So like they talk to professional. I don't know if you want, I can share this. It was hilarious, right? Like people talk about what they don't know, but as long as you look sexy, as long as you have a good camera, and you're good looking, people you'll still have followers. I love it. As a scientist, I really find it so hilarious.
Yes, but also depressing. I'd love to know that reference. Okay,
yeah,
so it doesn't look like
I'll find
we got
it out. I'll send it. Yeah, I'll send it. Okay, good.
Yeah, that'd be great. So we haven't had a follow-up, so I guess I'm not sure, but social media was definitely one source of where people got information, and it was not overall a very good source.
Yeah, but did you web scrape data from social media, or how did you
No.
get? How did you?
So this is no. So this is all also on the survey. So we had lots of questions on the survey. We had detailed questions by platform, actually. So separately on Facebook, on Twitter, on Instagram, where you did you see certain types of content, and also were you discussing certain types of information about COVID? So it was very specific to COVID, but different types of engagement on social media about COVID. It's a very, very rich survey.
But people, people may be ashamed. Like, remember, like when before Trump was elected, people were ashamed to say that they would vote for Trump, right? How about, like, people may be ashamed to say, okay, I take my news from Facebook, right? They may kind of pretend that they take it from the media.
Yeah, but no, absolutely. I mean, social desirability bias is certainly an issue with surveys, but the way we ask these questions, they're not the type that there's not really a reason to be social desirability. They're fairly neutral in their wording, which is simply, did you, well, partly it was, did you see certain types of content? And then it was also, did you share certain types of content? But the content we ask about is simply things like gratitude to health workers or news items. They're not value laden in that sense that would suggest people would not say that they did it. Yeah.
Okay, I got it. Okay. So thank you so much once again for joining us today. So for those who maybe joined later or have friends who might want to watch it, please get them access through YouTube, right? And definitely check the book by our speaker and scientific articles. So thank you very much. And
it was my pleasure.
See you later.
Thank you. Thank you for having me.
Bye-bye.